The most common causes of throat cancer is smoking, followed by alcohol and HPV. HPV is a virus that causes cancer of the cervix in women. More and more, we are finding that the increasing incidence of cancer, especially in young and middle-aged people, is because of HPV virus. So if somebody finds a lump in their neck, they must seek some assistance to find out why the lump is there. The other reasons why you must eliminate throat cancer is if you get change in your voice, if it starts to sound hoarse, or if you find that you are having difficulty in swallowing your food, then you must seek advice. To diagnose throat cancer, one needs to be examined properly. We would normally start by examining the oral cavity by putting on a headlight, look inside your mouth, then to have a look inside the throat to see if there's any cancer of the voice box or tongue. We would use an endoscope, a camera, which goes through the nose and looks around the corner. The camera doesn't actually go inside your throat, so there's no fear of choking or any other problem. And it's a very gentle examination. We get very good pictures of the inside of the throat, which are relayed onto a screen in front of you. So most patients should be able to see the throat on the television monitor. And if there's something wrong, then I can point out to them or take some recordings from it. Sometimes we need more information and then we have to do a scan. So for patients where I'm suspecting a thyroid cancer, I would normally go for an ultrasound scan. That's a scan that people have when they have babies. The other scan that we use sometimes is an MRI scan of the neck, and that gives very nice pictures of the inside of your throat and the neck to see what the reason for the lump is. The treatment for cancer of the throat is usually surgery if a patient comes very early. Early tumors of the throat, tonsil, voice box can just be removed with nothing more to be done. If a tumor is very advanced, then we need to give you something like radiotherapy, which is X-ray treatment, which can be spread over a period of 4 to 5 weeks. Sometimes we add chemotherapy to the treatment. But before any treatment is given, the patients are discussed at what's called the MDT. MDT stands for multidisciplinary meetings, where there are specialists who do surgery for throat cancer, radiotherapy, radiologists, pathologists. We meet once a week, and then we put all the findings on the screen and decide what's the most appropriate treatment for a person. And usually surgery or radiotherapy as far as head and neck cancer is concerned. In cancers of the thyroid, the survival rate is almost 100%. People die from old age, not from thyroid cancer in the vast majority of people. There is a rare form of thyroid cancer called anaplastic cancer, where survival is very poor. People are usually survive not more than 3 or 6 months. As far as cancer of the voice box is concerned, early cancer, 95% survival rate. We measure this in 5-year figures. So there are 100 people like you, and we see them 5 years later, then we know 95 people have survived, 5 will have died. By the time cancer has spread to the glands in the neck, the survival rate decreases to around 40 to 50%. So it's best to catch a cancer before it has spread to glands in the neck. Once it has gone there, it plummets. When the cancer has spread to the lungs, then of course the survival rate is much, much worse. And then you're talking about a year or 2.